couple years ago, I was at a conference and I walked by a booth. There was something called the Yomi robot. And I looked at it, it looked interesting, and I didn't really understand what it was. So when I was in the conference, I was thinking about it, and I was talking to my team, and we were talking about how we can better plan these things, give the patients a better result, a more time-efficient process, and more accuracy. And when it comes down to it, it's either guides or freehand. But I mentioned, there's something called the Yomi robot. Let me go take a look. And within 10 minutes, I bought two. It didn't take me very long to realize that this is a difference maker. It's the only thing that I could find that was going to make our team better at this. Since then, that was about 2 years ago, we have performed the second most implants in the country since we've had it in our office. It's been a complete difference maker. So how we utilize this robot is after the consultation, after the CT scan, we actually take all that data and put it into the robotic software. Then our team actually sits down and develops a surgical plan. So you don't just have 2 eyes looking at it. We're actually 6 or 8 eyes that look at this plan. We take that plan into the surgery day, and that allows us to move very efficiently. These implants are placed within a fraction of a millimeter of where we actually planned them. What that allows for the patient is one, a more accurate implant placement and a better looking prosthetic at the end. The other thing this allows patients are minimal post-operative healing pain. We don't have to flap bone. We don't need to see what we're drilling. We don't need to actually flap the patients and put these big stackable guides on there. We can actually see it on the robotic screen. And so the flap design is minimal. For patients that are on blood thinners, we can get around taking you off blood thinners because of this. We see our patients 2 days post-operatively. There's relatively no bruising, maybe a little swelling, but patients are only on Advil and Tylenol afterwards. It's a big difference from when we used to do freehand or use stackable guides.